Hello everyone. Welcome to welcome to our webinar on latest advantages in digital dentistry, featuring Dr. Arun Kumar M.D.S. We are delighted to have you all here today. We hope that you will find the session informative and insightful. As we all know, dentistry is an ever-evolving field with new technologies, techniques emerging all the time. In this webinar, we are privileged to have Dr. Arun Kumar share his insights and experience on the latest advantages in digital dentistry. So before dive into the show or before I invite our guest for the day, let me thank all of you on behalf of Anavara. Anavara is leading provider of medical wellness and health facilitator. We provide medical tourism across the globe, providing with list of hospitals and experienced doctors, and also keeping it in your budget. So let's invite today's specialist. Our expert today is an expert dentist, Dr. Arun Kumar. He is highly respected and accomplished dentist with extensive experience in dentistry. So he is a prosthodontist and dental surgeon in Mylapore, Chennai, and has experience of 25 years in this field. He practices at Arun's Dental Art, Mylapore. He's a member of American Academy of Implant Dentistry, Indian Prosthodontic Society, Indian Dental Association, and Independent Medical Practitioners Association, India. So doctor will provide a valuable insights, perspectives, drawing on his own research experience and best practices. We encourage you to actively participate in the discussion and ask questions to Dr. Arun Kumar. This is an excellent opportunity to learn from one of the most knowledgeable and experienced professional in the field. Doctor will also discuss the importance of ongoing education and professional development in dentistry. He will provide tips and advice on how you keep up to date with latest advantages in the field and how you take care of your dental problems and everything. So we hope that this webinar will be a source of inspiration, learning, and networking for all of you. Thank you for joining us today, and we look forward to an engaging and insightful discussion with Dr. Arun Kumar. Do stay with us till the end of the show. So without further delay, let's get started. Now I'm handing over the session to Dr. Arun Kumar.
Thank you so much for the wonderful introduction, Harini, and thank you so much, Anavara, for providing this great opportunity to share my thoughts and my experience in the latest trends and advances to replace and restore natural teeth digitally. That's an excellent introduction. Hope that I can live up to the tall claims made. And you've given me a time of about 40 minutes for me to present. And there's quite a bit of things which needs to be covered. So let's get on to it. So that's a brief credentials about me. So when you look at digital dentistry, or dentistry per se is basically a surgical aspect, right? So there's a lot of surgery involved in dentistry. So when you look at, so for any surgical outcome, our primary goal, even though it's a surgical discipline, our primary goal is always to replace a natural teeth. For example, in the photograph that I'm sharing with you right now, so a surgery has been done and a tooth has been given when the natural tooth has been completely lost due to an accident and due to a trauma. So when we replace the teeth using a dental implant with a digital dentistry to aid in doing the entire process, how close can we get to replace the natural teeth? How close can we get to the nature becomes the most critical aspects or most successful aspect will be our goal. So can we give a tooth that is as close to the nature as possible, even when the entire tooth is missing? So that would become the goal. And going forward, dentistry has evolved now at the moment. So it's not only a surgical discipline, it's not only a prosthetic discipline now, it has become an aesthetic discipline. So what I mean by this, so what I'm trying to share now is so dentistry has become like an invisible art form or invisible dentistry. Gone are the days where people used to be happily show around their gold teeth, right? So now you want to get your smile makeover done, you want to get your teeth corrected, but it should not be obvious to anyone who sees. So invisible dentistry becomes the norm of the day. So what I mean by invisible dentistry is, for example, in this teeth where I show a dental implant there is actually a tooth is missing there. but we have placed an implant and a natural, and the tooth is coming as close to the nature as possible. So the goal is more so has evolved from a surgical discipline to a prosthetic discipline to an invisible dentistry. So that's how our digital dentistry is helping us evolve to create these restorations which mimic the natural teeth as close to nature as possible, and making any dental work that we do almost invisible in the mouth. So what I mean by invisible here is, so it is as close to the nature so it doesn't show out, is what that we are looking at. So when it comes to digital dentistry or dentistry for that matter, there is always this lot of fear in our mind. There's a lot of always this concern whether it is safe, how accurate is it, do we actually save time, and is it going to be comfortable for us, right? So these four questions always keep repeatedly coming back to us again and again, right? So dentistry as well as digital dentistry, are they safe? Are we improving the accuracy? Why should we improve accuracy? Because only when we improve the accuracy, then there is going to be a more longer lasting restoration. There is going to be a more longer lasting dental work that can be provided, which is more safe and precise. When it comes to time, are we actually saving time? So when we want to take up a new, say a technology or something new has come in the market, how are we saving time by adapting that newer technology into our practice? And is it safe? Is it improving the accuracy? And all these things will matter of safety, accuracy, and time when the patients are going to be greatly comforted by the entire process, and it becomes even more convenient for the patient. So when all these four things come together is when the quadrant of success is what I would call it. So it becomes a successful treatment outcome. So digital dentistry in the present scenario, we'll be looking at in all the areas where we will see that how this is actually becoming a successful treatment modality. So now let's look at where all digital dentistry has evolved. The first thing what we need to understand is in terms of diagnosis and treatment planning. So when it comes to diagnosis and treatment planning, the tools that we generally used to use beforehand has now greatly been enhanced with introduction of a lot of digital aids. We have digital x-rays where we can digitally record the patient's tooth, and then those digital x-rays are only a two-dimensional view of the patient's teeth. We not only do digital x-rays, we can also do a CBCT, which is something called cone beam computerized tomography, where we can accurately capture in 3D the patient's tooth structure as well as the jaw structure with the underlying bone structure. So this is a huge benefit when it comes to diagnosis and treatment planning. Of course, we can also do a record of the patient's, and then we will be able to accurately diagnose it. So that's one. So next area where digital dentistry has come in leaps and bounds is digital impressions, digital smile design, and CAD/CAM milling. So I'm briefly touching upon these topics here. I will go into details of how these impressions are made, how these smile designs are done, and how do we actually mill a tooth. All these things I'll be going in detail in the next half an hour or so. So that's where these digital impressions are coming in. Now, so we spoke about two aspects, right? First, we spoke about X-rays, and then we spoke about digital impressions. Integrated implantology is something where we merge the X-ray findings and the digital impressions in one area, and then we will be able to actually three-dimensionally virtually plan how do we restore tooth. So I will actually show with actual patient photographs how this digital dentistry, where we can do an integrated implantology, can be actually done. Next important aspect is called single visit dentistry, and in single visit dentistry, the typical time frame is when we go to a dentist to get a crown done or to get a veneer done. It's usually a two-setting process where it takes approximately a week's time, where the dentist makes a measurement and then sends the measurement to the lab. The lab, gets it back. But with digital dentistry, that entire two-sitting process can be made in one visit, where we not only make an impression, we also make a crown, a zirconia crown that is very accurate, durable, and long-lasting within 60 minutes, and then be able to fix it. So that's what single visit dentistry is all about. That's the advantage of digital dentistry. Then we have invisible aligners or Invisalign clear aligners, which helps us to move the teeth. So this is also possible using digital dentistry. And of course, in terms of communication, record maintenance, all these things are advantage of going digital. So when we look at the benefits of it, we saw the advantages, we saw where all digital dentistry is being used. When you look at the benefits, of course, we save time, aesthetics, because we can get lifelike restorations at the comfort of the patient, at the same time improving the accuracy of the restoration which we give. Accuracy here is very important, because when the restoration we give is more accurate, they last longer, and the functioning of the patient is greatly enhanced by the accuracy of the treatment that is being given. And when you do, when I mean by single visit dentistry, there are 4 critical steps when it comes to single visit dentistry. So what are those 4 critical steps? The first step is making an impression. In this impression, we use a digital method to make an impression, which I will be showing an actual demo of how this impression is being made. So once this digital impression is made, the second part is designing the restoration. The tooth that we are going to make is actually designed using an intuitive computer software, where we can actually design a tooth structure. And then the third aspect is the milling aspect, where we will use a milling unit to actually fabricate the tooth structure. The final aspect is called the sintering. And sintering is a process in which the fabricated tooth structure undergoes a strengthening process, where once the strengthening process happens, the tooth is actually be ready to fix onto the patient's mouth. So this is what single visit dentistry is in short. Those 4 important steps of impressions, design, milling, and sintering. Now let's start with a digital precision for CBCT. Here in this video, you're actually seeing a CT scan done for the patient's mouth. So this is done to record the patient's jaw structure. You can see the entire jaw structure is being recorded in 3D, where within 14 seconds, the patient's entire jaw structure X-ray is actually taken in the form of a cone beam computerized tomography, or a CBCT, and see the patient's jaw is being recreated. Now, once this patient jaw is being recreated, we actually measure the bone quality, we can measure the bone quantity there in that, and then we can actually plan how are we going to replace the tooth, or how are we going to replace with the dental implant of the tooth. What is it that we are going to do is what that we will be seeing in that. So once this is done, the next comes, so we have now taken the patient's bone structure. Now we need to capture the patient's photograph, patient's tooth structure, and the gum structure. So then this is when we use a digital workflow or a digital scanner. The photograph that you see is a scanner that we use in our practice, where you can actually see me making a digital impression, and it's a real-time impression. You can see me scanning the tooth with an intraoral scanner, and as I scan, the picture of the tooth is getting captured onto the computer screen. So that is what is happening. Once the picture is scanned onto the computer screen, I can actually design a tooth, and then this is the milling unit. So this is the third step. The first step of impression is done. The second step is design. The third step is what is called the milling. So this is when, if you can look at it, the tooth is actually being shaped. So the patient can actually see their own tooth getting made here. So the tooth is getting milled. So once the tooth is getting milled, we have the raw tooth structure there. So this is what is the sintering unit. So in the sintering unit, it goes into the sintering unit and then comes out. So this is what. So let me repeat this process. First is the impression, where we use an intraoral scanner to take a real-time 3D image of the patient's jaw. You can see it on the computer screen now. Once we do that, we actually design, we can see the tooth getting designed now. Once we design the tooth, this design is fed to a milling unit, where the milling unit actually fabricates the crown. Right? You can see the milling unit actually fabricate the crown. We start the process and the crown is ready to be made now. So whatever design that we have done, the milling unit makes the crown now. So once a crown is made, now we need to strengthen the crown. That's the fourth step, or the sintering process. And once it goes to the fourth step of the sintering process, it comes out, and then the crown is ready to be fixed into the patient's mouth. So this is what happens. If you look at it, I can show you some actual patient clinical scenarios where we can use digital dentistry to, for example, in this particular case, we have used digital dentistry to close the spaces between the teeth. The patient was not happy with the spacing that is present between the teeth. So we have used veneers to actually close the space so the tooth will look as natural as possible. So this is a case where we have done a smile design. All the patient's teeth were not in one alignment. So there's a lot of proclination of the teeth. There were gaps. The teeth were not all aligned. So we can use digital dentistry to do what is called a smile design. How we go about doing the smile design also will be further discussed as we go through the presentation. Here, in this particular scenario, there is a hugely discolored teeth, which gives a very unsightly appearance when the patient smiles. So again, using digital dentistry with a crown, we'll be able to change this discolored teeth into a normal looking teeth within a span of 60 minutes. So that's the beauty of digital dentistry, right? So you need not wait for this correction to happen for 1 week or 2 weeks. We'll be able to do it real time. We'll be able to do it within 60 minutes. So within 60 minutes, a single crown can be made. So that's the advantage of doing digital dentistry. In this, we just not only change the crown, you can look at this particular photograph where we have done a root canal also. And once as the root canal is being done, the crown measurement is actually being made. So by the time we complete the root canal, the crown can also be fixed. All this within so probably because it's root canal and crown, it's going to take 2 hours. So within a span of 2-hour visit, we not only complete the root canal, we can also give a crown. All this within a span of 2 hours can be done. So the broken tooth that is there, which has been treated by doing a root canal treatment, and then giving an Emax crown, which is going to make it look as natural. So that's what is here done. In this particular, sometimes what happens is we chip our teeth while eating something hard. Usually the front teeth chips off. We can give a tooth that is as close to the adjacent teeth, as close to the nature as possible, without even anyone noticing that you've got something artificial done, or something like a crown done on your lower teeth. So that's what in this particular case, you can see the actual design that is being done in the screen, and the crown is being fixed onto the patient's mouth, all within in one visit. So it's not only a single crown. We can even do like a multiple tooth scenario where there is multiple tooth have got decayed. Angle correction can be done. Like a lot of decayed teeth can all be corrected. Of course, when it comes to multiple teeth, because since more teeth is there, we might have to do it as a 2-visit appointment, because it becomes easier for the patient when you do it as 2-visit appointment. But still, these appointments can be spaced as close to each other as possible, so which helps us to save us a lot of time. So all this is possible by using CEREC. So when we use CEREC, the advantages, when you typically go, we use a conventional impression material, right? If you go to the dentist, so they'll use a tray. In the tray, you will have impression material that is put onto the patient's mouth, right? So, and then the tray is taken out. Here, we are only digitally scanning. So there is no gag. That smell of the impression material in your mouth is not there. And we need not wait for a very long time to get the impression material. So when compared to a traditional way, where the tooth is prepared, measurement is made, it goes to the lab, and then there is another appointment, which is typically happens in a second appointment, which typically happens after a week's time, and then for the crown to be cemented. Here, it can all be done within 1 hour. So that's the advantage of using CEREC to do it. So that's the workflow for you. We prepare, we scan the tooth, as I said, and then we design, and then we restore it. So this is the unit which actually helps us to scan. That's the acquisition unit, is called the scanner, where you saw me actually digitally scanning the patient's mouth, and then we mill it, and then we use the sintering furnace. That's basically the unit. That's the intraoral scanner. So, and it's very accurately precise 3D scan in color is what is there. You can see that you are able to see the real-time 3D capture of the patient's mouth. You are able to see that. So we can even restore full mouth there. So this is a full mouth rehabilitation with an EMAX scan. Almost all the patient's teeth were worn out, untreated. So patient was not liking the smile. They had a very appearance of an extremely old age because of the tooth were worn out, discolored. We were able to completely restore it digitally using an EMAX scan. Again, this is another case of smile design, a complex smile design. The patient's teeth were not proportionate. Patient was not happy with the amount of teeth show. There were gaps between the teeth. So now they wanted the gaps to be closed. They wanted the teeth to be proportionate. So the smile design was able to done with EMAX scan. This is how we are able to achieve the final, all the gaps that were there. They will be able to close it with veneers, and that's how we are able to complete the treatment. So all the gaps were closed, the teeth were made proportionate, and the teeth were all aligned, and all these were able to do it in using smile design with a specific material called EMAX scan. So that's the benefit of using a smile design and then using CEREC here, because typical zirconia crown are not very aesthetic, and it takes a long time. But when we use CEREC, when we use digital dentistry, we can all make it happen in one visit. So there is speed, and instead of the impression material in your mouth for more than 5 minutes time, within a minute's time, we can capture the entire jaw without any material present in the mouth, without any gag that is there. That is the speed that is there. It's very accurate. We can accurately capture to a micron level, and then so that the restoration that we get precisely fits it. Usually when you go the conventional way, there will be a lot of adjustments that is required. Here there is absolutely or no adjustments, or sometimes very minimal adjustment that is required. So it's very accurate, it's very easy, and it's extremely hygienic, because this complete hygiene control is possible, disinfection is possible. So it's very, very safe to use. It's been documented, it's been researched that of the safety there. So and also we can, as I said, right, we can do a design in terms of smile design. So that's how a smile design is done. So I thought I'll show you a smile design where we not only capture the patient's data, and then we take the patient's photograph. The patient's photograph is then merged onto the face to see how the patient's smile is going to look post the design. So that's how it happens. So we take the patient photograph, capture the patient's tooth, design a smile, merge the smile design onto the patient's face, and then see how the patient is going to look post the smile design before we actually go ahead with the treatment. So that's how this is being done. Of course, we can do it. I said about integrated implantology, where chairside implant treatment. This is a virtual articulator which we can do. Because many times what happens is when the patient, when the tooth comes from the lab, the bite, the way the upper and the lower teeth joints might not be very accurate. So here, using a software, we can virtually check how the patient's upper teeth and the lower teeth joints. Because we can virtually check how it joins, we'll be able to accurately reproduce the bite. And that's the milling unit and the sintering unit. So and it's not I said about full mouth rehabs, I spoke about smile design, and I spoke about implants, right? So there are a lot more work that can actually be done with CEREC. It can be like inlays and onlays, which are partial restoration, not full restorations, partial restorations. We can do full crowns, we can do veneers, and we can also do like a guided implant planning. So let's look into guided implant planning a little before we go into the next part of our presentation. So this is what integrated implantology is. So what is integrated implantology is so all these while when you're looking at the previous photograph that I showed, the patient had their natural teeth, and then we are able to give a crown or design a smile on the natural teeth. So when the patient loses their natural teeth, they don't have the natural teeth, then we need to do an implant. And once we do an implant, then we need to give a tooth on top. So that was the earliest photographs which I showed about the surgery, the surgical goal, the prosthetic goal, and then the aesthetic goal, right? If you remember, that was the earliest photograph. So this is what we do using integrated implantology. What we do here is we take a CBCT scan, which I showed you initially, of me explaining to a patient how a CBCT data is we get, and then we do a chairside CEREC scan. We merge those two data of a CBCT scan, that is patient's X-ray, CT scan, along with the patient's tooth scan. Once we merge the two data, we will be virtually placing implants on the scan. And then once we virtually place an implant on the scan, we can explain to the patient what the quality of bone is, how the tooth is going to look, and how the entire restoration is going to come. So now this is how we design it. Especially when it comes to lower jaw, we have the nerve. It's very important to plan where we place that implant, how the tooth is going to come. Once we do that, we can actually check in 3D accurately number of implants we need to place, what is going to be the length of implant, what is going to be the diameter of implant, where the nerve is, and how the tooth is going to come. All these things can be virtually planned. Even before this, all this is happening, even before we are doing the surgery, everything has happened virtually. So we are very clear how the entire plan is going to be, right? So there is no surprises left. We are actually doing a virtual plan, and this data can be shared with the patient, can be used to explain to the patient, so that the patient also understand what is the actual process that is going to happen. That's what it happens. So once we do that, we can actually make a surgical guide. If you look at it, this is the actual patient maxilla and a guide that is being made. So now this guide fits onto the patient maxilla. So now, based on the data that is there, we show it to the patient, and once we get the patient approval, we can actually manufacture a guide. And once we manufacture a guide, we can actually do a guided surgery. So, and when you do a guided surgery, it's very accurate, and we'll be able to give even a full mouth implant. When we do, we'll be able to restore probably within a span of 3 to 7 days time, even a full arch implant workflow, so that a patient's entire jaw is having a missing tooth. We can extract teeth and then do implants, and then also give tooth on those implants within a span of 7 to 10 working days, which is a great turnaround time. Typically what will be taking about 3 to 4 months time, we'll be able to do it in a very enhanced, a fast track manner using digital dentistry. So that's what it happens. So now let's some more cases here where we'll be able to see this tooth here now. Now we are actually, an patient is having an implant that is being placed. You can see the tooth is not there. The implant has been placed, and once the implant has been placed, we are actually not only doing a tooth here, we are actually recreating the implant tooth also. And you can see that implant teeth being recreated accurately. This is how the implant is being fixed onto the patient's mouth. And that's the final tooth that is being placed. Likewise, here also we can see when for example, the patient came with a completely broken down teeth, where we need to remove the tooth structure. And once the tooth structure has been removed, right, we are here to place an implant there. And once we place an implant, You can see me scanning the tooth structure there. And then the scanned tooth structure, we are actually designing. You can see me actually scan the implant position. And once we scan the implant position is actually being captured real time onto the computer screen. We can design a crown now. Once we design a crown, we can actually manufacture the crown on the left side of the screen. You'll be able to see the actual design that is happening and then the actual milling that is happening. So once the crown is out, we can then fuse the crown to the abutment. What you see me take out is called an abutment. So this abutment is taken out. The crown is fixed onto the abutment, and once the crown is fixed onto the abutment, then we can fix the crown back. So it gives a very accurate crown, right? So this can also be applied to the front tooth scenario, where here in this particular case you can see a completely broken down tooth where we have placed an implant there. You can see me removing the crown there. So the patient does not have a tooth there, but implant has been placed. The entire planning has been done digitally. The crown is also made digitally, and everything is made in-house. So I also do the implant surgery. The crown is also made in-house. And the final crown, so all this, so from no tooth to remove the tooth, to placing an implant, to getting an artificial tooth, all these things can be done in one visit. So that's the advantage, right? So you need not, even if it's a front teeth, you need not be without your teeth even for one visit. So that's the advantage of doing this digital dentistry. Likewise, we'll be able to not only restore, when this is another patient where one tooth was missing, but the other tooth was also involved in an accident, so the tooth was broken. So it's not that all the tooth has to be restored with implant. Some tooth we can do root canal and crown, and some tooth we can restore with implant also. So that's the advantage of it. So likewise, digital dentistry presents a multiple advantages. If even for a very complex scenario where we need to do a surgical reconstruction of the entire tooth also, we'll be able to take the tooth out, digitally position the tooth. And in this particular case, is a very interesting case. This is how we are able to complete the case, but the patient had a complete absence of tooth structure. There was, due to the infection, the entire tooth structure was lost. Because of the entire tooth structure was lost, we were able to completely, you can see the completely broken down tooth structure with a lot of infection. We were able to digitally plan the entire thing, remove the infection, graft the entire thing, and we are able to restore the patient's smile from a completely broken down tooth. So that's how we are able to finish the smile. So when the patient smiles, it's just not possible to actually note that we were able to actually complete it. So these are natural, they all look like a natural tooth, but they are actually all surgically done. Again, likewise, I will be able to show like innumerable number of cases where we will be able to do a treatment planning. So in this particular case, we not only got implant, we were able to actually do the implant and then do a smile design also. You can see me actually merging the patient's tooth, the implant data to the patient's face, and then this is surgery and also smile design combined. So not only doing a surgery, but also doing a smile design combined with it, and then getting the patient's smile accurately. And if you look at it, it looks so natural, so invisible. So that's how we finished. Likewise, we'll be able to do more complex cases are being done with this, and that's how we are able to complete it. where implants are being placed. So all these things has got a lot of digital component to it. There's a lot of digital planning. It's more easier to the patient, convenient to the patient. That's all. So so we are coming to the last part of it. So I've been given a mandate to finish the presentation within 40 minutes. I've got another 3 more minutes to go. So the take-home messages we saw in this, how digital dentistry has evolved over a period of time. That is, so right from the days where we only made manual measurements, x-rays were taken with films. There used to be dark rooms, so where we need to take a film x-ray and then go and process in the dark room, and then when we come out, those x-rays, we need to wait and watch to see how those x-rays are. Now we have evolved a long way. Not only we are taking digital x-rays, we are actually taking a digital CT scan. We're also taking face scans. So we also saw the benefits of digital dentistry, how much of taking impressions of the patient's jaw has evolved. Also, we saw in the presentation how the patient need not have the impression material in their mouth, how that bad taste of the impression material can be avoided, the gag that is there can be avoided, and how fast the impression can be made. Within 1 minute they can actually make the impression, and how accurate that impression is also made. Also, we had a look at that, and we also looked at the safety, accuracy, and the comfort of very complex restoration, right from a simple a small filling that needs to be done using digital dentistry, to a complex restoration where you're designing the entire smile, to a even more complex full mouth rehabilitation with either with implants or a combination of implants and smile design. So digital dentistry has evolved to involve multiple aspects, but at the same time, it's very safe. It has improved the accuracy of the treatment that we give to the patient. It saves a lot of time to the patient and also to the dentist. Because it saves a lot of time to the patient, there is a lot of comfort and convenience to the patient. And so that's how digital dentistry has evolved, and that's the reason why it is being successful. I hope you enjoyed the presentation, and if there is any questions, I'll be happy to answer. And that's our Pearls Dentistry website. Our practice is based out of Chennai, Raja Annamalapuram at Algarpet. We have been practicing since the year 2001. If there are any questions, I'll be happy to answer, and thank you.
First of all, thank you for your crystal clear presentation, Doctor.
Yeah,
It's very interesting and informative.
thank you.
Okay. Folks, I hope your knowledge has been expanded by this webinar. It's time for your questions. If you have any question, you can raise your hand one by one and ask the doctor. Yeah, Rabi?
Okay, so the question is, what does Hollywood smile mean in dental care? So that's the question. See, Hollywood smile is a smile, is a kind of smile design. So where we use a specific material to get a specific desired shape and desired size to the tooth and a desired color to the tooth. So what we do in Hollywood smile is we use one specific material by a material called Emax, and they have a shade called opalescence or opal, which gives a really white color teeth. It'll be like a pearl, it'll be like an opalescent teeth. So, and then we can actually design the particular shape to it, and we'll be able to give that's what a Hollywood smile is. So we can do it using digital dentistry, give an Hollywood smile. I hope that I answered that question. The next question is, how would you handle a pediatric patient who need an extraction? Right. So when it comes to children, it's always it depends on the age of the child. So anywhere. So the question is not, it's not the children don't want to be cooperative, they lack the cooperative ability. So generally, when it comes to pediatric patients, of course, I always say when it comes to, there are two kinds of extractions that can happen in a pediatric patient. It's an exfoliating teeth, That is, when before the teeth has fully fallen off, the permanent teeth has already come out. So in this particular instances, usually the middle tooth will be shaking and the permanent teeth must have come out. So it's a very simple process where the very important thing is to get the confidence of the child there, and then we'll be able to, when using a simple tool, making the patient child very comfortable, we'll be able to take the tooth out. But sometimes when it comes to a complex tooth removal, the tooth is decayed, where the child lacks cooperative ability. Usually this entire process is done under general anesthesia. So when you do it under general anesthesia, unlike adult, general anesthesia for children is very safe. It's done as a day care procedure. And typically, so usually when children present, they not only have an extraction, they might have some pulpotomies or pulpectomy. So we combine multiple procedures that is required for the child. All these things can be done in one visit. And we can do this in general anesthesia, usually a day care procedure, a 1 hour procedure where, and probably we'll monitor the child for about an hour's time, and the child is good to be discharged within a couple of hours time. So that's how we manage pediatric patients in dental clinics. Any other questions? What's the difference in orthodontist and a dentist? Do they use different methods for a regular? I'm sorry, I lost that question. Can somebody help me with that question? What is the difference between orthodontist and dentist? What was the full question? Harini, can you help me with that full question?
Yeah. What is the difference in orthodontist and dentist? Do they use any different methods for regular dental procedure?
Okay. So I put it simple. All orthodontists are dentists, but all dentists are not. So it means that dentistry is a specialized field. For example, I am a prosthodontist, right? So dentistry is taught at an undergraduate level, also as a postgraduate level. So a dentist who has had an additional qualification helping to align the teeth is what an orthodontist is. Like, for example, I specialize in tooth replacement, in smile design, in doing implants, parts of face missing. I'm a maxillofacial prosthodontist, so I help in doing implants, replacement of gums, tooth structure, and bone. An orthodontist is the one who helps in aligning the tooth, like putting braces. So that's what an orthodontist is. I hope the difference is clear. Likewise, we have got other specialties. We got an endodontist, we have got a surgeon, so we have got a periodontist who deals in gum disease. Likewise, there are different other specialties that are available. So what's the next question? Harini, can you help me with the question?
Yeah, doctor. As there are a lot of type of tooth implant available, which type of tooth implant is best, doctor?
Okay, so I'll put it this way. So the most commonest tooth implant we use are called root form implants. That is, when I say root form implant, those implants and the tooth which we give on top of those implants looks similar to our natural teeth. And when we choose an implant, it's very important. There are many commercially available implants that are available in the market. It's better to go with the best implant that are there. And I say a best implant that has been in the market for many number of years. There is a lot of original research behind those implants that are there, and those implants has been functioning in the patient's mouth for very, very long number of years. So because all titanium implants function well, but what is most critical is how clean the titanium implant surface is. So when you go for these premium brands that are either European, Swiss made or US made, they undergo a lot of diligent quality control process to ensure that those implants are very clean surfaces. That's one. And two, they have got a lot of original research behind those implants. And three, most of these implants are practiced across the world. So even if you get the implant done in India, your dentist at some other part of the world might be able to attend to the implant if something is required. So that would be the best implant, if you ask me.
Okay.
Any other? Yeah, Harini.
Can you highlight veneers and its porcelain veneers better than implants?
Okay, so now what we are looking at is we are looking at two different treatment options here. An implant is given in when a natural tooth is missing in the first place, right? So when you don't have a tooth at all in the first place, I get a dental implant done. So once I get a dental implant done, then we give a tooth on top of it. So that's what a dental implant is. A veneer is given on top of an existing natural teeth. For example, I have a natural tooth. My natural tooth is not in great color, it's discolored. Or I have a natural tooth, there is a lot of space in my natural tooth, or my natural tooth is crowded. So now I have a natural tooth, but my natural tooth is not to my liking, or I am not happy with my smile. I don't like the color of my teeth. There we get a veneer done to get the natural, to get the smile of our choice, to get the color of our choice. So that's how a veneer helps. When I get a dental implant where I don't have a natural tooth, I've lost my natural tooth because the tooth shook and fall, or somebody extracted the tooth, something happened to my natural tooth, so I need to get a dental implant. So that's the difference between an implant and a veneer.
Okay, doctor. Thank you, doctor. How I determined porcelain implant and zirconia implant would be suitable for me, considering that the quality of implant matters to me, but I have minimal budget for the treatment.
Okay, see so when you look at it, when you look generally, those titanium implants are pretty long lasting. So when you go for a titanium implant, you will have the best method would be to go for a titanium implant with a zirconia crown on top. So when you have a titanium implant and a full ceramic crown on top, you get the best of both the worlds. So and titanium are known to our most biocompatible material, and because they're and they have been known to function in mouth for many years to come. So get a titanium implant done and a ceramic crown on top, you get the best of both the worlds. So that's how it helps.
Okay, doctor. How long does veneers last?
Okay, so veneers last. So veneers last for, see, anything that we do in the patient's mouth, we don't. So we usually say that they are definitive restorations. They can last for more than 7 to 10 years time. So when I say that 7 to 10 years time, it doesn't mean that it has got an expiry date. After 10 years, we need to change it, right? So the reason we say 7 to 10 years time is because veneers, our mouth is a biologic environment, right? There's a lot of saliva in the mouth. There's a lot of bacteria in the mouth. The way our gums behave, the way our teeth behave, the way our bite is over a period of time can change. So usually veneers last for many years. So if your bite is favorable, your maintenance is going to be good, they can last for more than 10 years time. Next question, Haruni.
Yeah, doctor. Normally, how long does digital dentist last?
Okay, so all right, I'll put it this way. So I would make a differentiation here between digital dentures and digital crowns. With digital crowns, they last for many years. There is no problem at all. Again, 10 years, 15 years, they can last a lifetime too, because if it's made well, if it's going to fit well to the underlying tooth structure and the teeth is being maintained well with periodic dental visit, they can last for a very long time. I would say periodic dental visit is very important to identify any new problem that can crop up under the tooth or in some other place. When it comes to digital dentures, so dentures is something is given on the patient's gum structure without tooth. So they just rest on the gum structure. When they rest on the gum structure, our gums and the underlying bone under the gum undergoes a process called alveolar ridge resorption. Our gums keep shrinking over a period of time. So because our gums keep shrinking over a period of time, digital dentures, because they fit very well, helps to reduce the amount of shrinking of gums that happens. But however, even though they reduce the shrinking of gums, the shrinking of gums is a natural process. It happens when we lose teeth. So because it happens naturally when we lose teeth, once in 5 years time, we might have to either reline the digital dentures or make new ones. So that's what it is. I hope I answered the question. Yeah. Next question.
Okay, next. Please advise, is teeth whitening good for my teeth? I have heard that it causes tooth to ache sometimes after it's done.
Okay. See, now teeth whitening is a perfectly a safe procedure, but we should understand the plus and minus of teeth whitening. So what happens is only certain kind of teeth are amenable to teeth whitening. For example, if the tooth is completely discolored, right? Veneers might give a better results than tooth whitening. But say over a period of time, there is a lot of food stains that has happened, carbonated drinks, cola drinks stain has happened, some habits like chewing has caused some teeth stains. Doing a cleaning and a polishing and a teeth whitening using lasers is a very safe and effective method to whiten our teeth 2 to 3 shades lighter. Important thing I'm saying is, for example, if we want our teeth to be whitened by say 6 shades, then what happens is we are trying to completely expand the amount of whitening that we can get by using teeth whitening methods. Then it can cause some sensitivity to the teeth. But if you're going to work within the confines of what is safely can be done for whitening, we explain to the patient, make them understand, okay, 2 to 3 shade whitening is possible. Beyond that, we need to look at other forms of whitening. It's perfectly safe.
Okay, doctor. Anybody have any questions?
Doctor, I have a question. It said that placement of the tongue and as well as the way we eat changes the facial structure. So is it true?
I'm sorry, placement of the
Tongue
okay.
and the way we eat changes the facial structure, the jawline and all of it. Is it a true thing?
All right. See, the tongue is the one of the most strongest muscle that is there in our body. So it has been proven. Like for example, some people have got a tongue thrusting habit, right? So what it means is, so usually when we swallow saliva, you can check yourself when you swallow saliva and see once your tip of the tongue will rest on the top of the upper teeth. That is, it's called the incisive papilla region. That's where your tip of your tongue should rest. But for some people, when they swallow saliva, the tip of the tongue comes between the upper and the lower teeth. For them, if you look at it, they have a teeth that is very proclined in nature. They have gaps between the teeth. They've got spaces between the upper and the lower teeth. So it's called a tongue thrusting habit. So it's just that, so what you're saying is completely true. The position of the tongue and the way we move our tongue can have an effect on the teeth. Absolutely true. Then the second thing is the way we eat, right? So for example, some people have got so when I say way we eat, there are two things here. I would put it as habits rather than just eating alone here. Habits. When I say habits, it's like, chewing pan, chewing supari or a long period of time, or, constantly chewing gum. Or some people have a tendency to clench their teeth, grind their teeth. The difference between clenching and grinding is clenching you do it during daytime when you're awake. Grinding you do it at night time, right? So when you have all these habits, they can wear the teeth structure. Because the tooth structure is worn off, the way our upper and the lower teeth joints will be different, causing an altered face structure. So what you're saying is true. It does have an effect on the way we look and the way our teeth function. Correct.
But normally it says that one should always place the tongue on the roof of the top, like when the mouth is shut. So it has to be like that or not? Because something called as moving was trending on YouTube and other platforms.
No, that's what has to naturally happen. If it's not naturally happening, so if you consciously try also, it's going to be like little difficult to do it. So if it's not naturally happening, when you go meet a dentist, the dentist can give you like small trainer appliances if it's not going there. Otherwise, it's a natural tongue position is there. That's how the natural tongue position is.
So you're saying that normally the tongue should rest on the roof of the top, like roof of the mouth.
Not the roof, it's at where your upper teeth joins the upper gum on the inner aspect. If that's what you're meaning as roof.
Roof in the sense like the upper side of the,
Correct.
Yeah.
Because roof is typically far behind the palate. Then you might have to do like yoga for the tongue to go reach there. So so when I say roof of the tongue, it's like where the upper teeth on the inner aspects of the upper teeth where it joins the gum. That's the perfect space to be there.
Okay.
Any other questions?
Doctor, it is possible to get braces for only one teeth?
It is okay. It is definitely, it's possible to get braces for only one teeth, but but not by the conventional method. I think the question is, if one teeth alone is, say, crooked, can I get it aligned? If that's the question, if one tooth alone is crooked, it can get aligned, no problem at all.
Okay. Any other questions?
And
Yes.
doctor, let's say, sorry, Harini. So while doing braces as well, doctors normally remove the wisdom teeth. So do you think it's the right thing to do? Like wisdom tooth has any impact on person's health, or does it have any benefit to the person?
Okay, see, all right. So one thing, as to the benefit of the dentist, we only remove the teeth, not the wisdom. So it's like, so see, removal of the wisdom tooth or not removing the wisdom tooth basically depends on whether the wisdom tooth is actually causing problem for you. For many people, as we have evolved, the tooths are jaw size because we don't chew as much as our forefathers used to chew. Our food has become far refined, so our jaw structures have become smaller, and because we don't have so much of chewing happening, so the last tooth that is going to come out in the mouth are the wisdom tooth. So they don't have enough space to come out in the jaws, so they get stuck inside. So if they are stuck inside, they have not come out at all, it's perfectly safe to leave them. There is I am more conservative in my approach to wisdom tooth, when it comes to wisdom tooth removal. But when it is out, say it's causing food impaction, it's causing decay of the adjacent teeth, then benefits of removing the wisdom tooth are greater. So when it comes to wisdom tooth, always we need to examine the benefits of getting the tooth out vis-a-vis the risk or the complications associated with wisdom tooth removal, and then take a call based on that. So it's an individual, patient dependent related scenario.
Okay, thank you.
Yeah, Rabi?
Okay, yeah. Welcome, doctor. Good day. Nice
Thank
to
you.
have you. Yeah. My name is Rabi. I'm from Nigeria. So I have two questions. My first question is can rotting teeth increase white blood counts? And my second question is what causes teeth sensitivity?
Okay. So I need your first. I'll first answer your second question. What causes teeth sensitivity? You might have to repeat the first question. I didn't understand the first question, but let me answer your second question first. Right.
Okay.
So teeth sensitivity is typically caused by, can be the problem in the tooth per se, or it can be problem in the gum. Right. So let's first differentiate that and then see one at a time. So when it comes to tooth per se, the typical cause of teeth sensitivity is wear of tooth structure. So when I say wear of tooth structure, so the wear can happen by three different methods. The wear can happen on the chewing surface of our tooth. The wear can happen on the surface of the facial surface, or the surface that is seen outside, or the wear can happen on the inner surface, that is a surface that is present towards the tongue. So the wear between these three surfaces are caused by different methods. So the wear on the chewing surface is typically caused because of we grind our teeth, we clench our teeth, causing wear and tear. This grinding and clenching can lead to minute cracks, wear away the enamel, expose the dentine, and cause teeth sensitivity. That's one. Two, the facial surface wear is typically caused because of hard brushing. Either we use a hard brush, or we use too much force with brushing, or we brush too many times, or we use like a coarse tooth powder to brush. So when you use all those things, the surface is worn away, removing the dentine, enamel as well as the dentine, and then the tooth can get sensitive. The third type of wear is called erosion. So this erosion typically happens on the inside of the teeth when we have like an acid reflux, or some people have got a tendency to drink too much cola. So all these things can cause erosion. Erosion is a chemical wear, so it's acidic wear. So the tooth will appear very smooth and glazed, as if it's been like polished like a mosaic polish. So that's an erosive wear that can also cause sensitivity. So these are the three reason, the tooth dependent reason of sensitivity, of wear of tooth structure. Another reason for sensitivity is any tooth decay in initial stages will present as a sensitive tooth. Even though there is a decay, before the patient actually develops pain, the tooth is will cause sensitivity, because the first sign of decay can be sensitive tooth, because we need not see the decay. A sensitive tooth, because the enamel has become soft there, anything hot, cold, or sour can easily reach the nerve of the tooth and cause sensitivity. So all these things, what you need to understand is sensitivity is because the outer enamel, which is the hardest structure in the body, has worn away, exposing the inner softer layers and inner nerve layers to the outside, causing sensitivity. So then I said the gum dependent, right? The other part. The gum dependent happens because of gum inflammation or gingival inflammation. When gum is inflamed or gingival inflammation is there, the gum doesn't hold on tight to the teeth. When the gum doesn't hold on tight to the teeth, it exposes the root surface. The root surface does not have enamel, it's called cementum. So that can cause sensitivity, because cementum is not as hard as enamel. For some people, because of this gum inflammation, there's a lot of gum recession, exposes the gum. They know the gum goes down, exposing the root surface, can cause sensitivity. So these are some of the causes of sensitivity. I think that sensitive teeth can be like a 1-hour webinar. So I hope I've explained most of it to you. So what was your first question, please?
Yeah, doctor. Okay, my first question was, will rotting teeth, the tooth that's already rotten, will it increase white blood count?
Routine teeth is, I'm sorry,
Rotting teeth.
rotting teeth,
Yes.
rotting teeth.
A
All
decay,
okay,
yeah.
okay. A decay teeth. I'm sorry. I'm sorry. I got
Yes.
a
Decay,
decay.
yeah.
Right. Okay. So what happens is, so when the tooth structure per se, right, is there is no blood supply to the outside of the tooth structure. So when the decay that is there on the enamel surface goes to the dentine and then involves the pulp, is only first time it comes in contact with our body's blood supply. So a decay that is only present in enamel and dentine is very unlikely to cause an increase in your white blood count. But when it reaches the pulp, usually it gives you an acute pain. And then the pulpal infection proceeds to our bone, proceeds to the underlying tooth structure, right? So that time when the infection is not just limited to the tooth structure, it goes beyond the tooth structure to the surrounding periodontium. So in that case, because the infection is there inside the bone, that infection can cause can have general body repercussions in terms of any infected process that happens. When it comes to an increase in white blood count, what we need to understand is the infection of the gum, that is of the periodontium, there's a lot of plaque deposits, there's a lot of tartar and calculus. That plaque and calculus and tartar that is there in our gums, that affects the bone, has got a more tendency to cause far greater problems to our general health. Not just our blood clot, it can cause, it's been proven that a weakened tooth with a lot of plaque and a lot of calculus deposits can also have got an increase in the atheroscleromatous plaque deposit that has happened in our arteries in the heart. It's been proven that, research has proven that a lot of plaque and calculus deposits during pregnancy can cause low birth weight babies too. So more gum disease and gum infection has got a far greater reach effects on our general health than just tooth decay. Tooth decay left unattended over a long period of time has also got a far-reaching effect on our general health. Hope that answered the question.
Yeah, sure, doctor. Thank you.
Welcome.
Yeah, any other questions? Yeah, okay. Okay, thank you, doctor. We are really glad that you could take time out and conduct the much needed webinar on digital dentistry.
Thank you. Hope it was helpful. I would be happy if there is anything. I would be happy to take up questions through email or something. And thank you for this excellent webinar. Thanks for giving an opportunity. And thank you so much. Thanks. Thank you.
And I also thank the participant for attending today's webinar. If you want to consult Dr. Arun Kumar, you can contact Anavara. We encourage you to connect with us on social media. If you have additional questions, you can contact by email or telephone. We are happy to provide additional support. Thank you.
Thank you. Bye-bye.
Thank you. Bye.